Hi, everyone. Welcome to another edition of the Cameroon Town Hall for Healthcare Professionals. We are actually at the 45th edition today. Wow, wow, wow. It's been quite a journey. We're all excited to see how far we've come, shedding light on some of the strengths and areas for improvement in our healthcare system, home and abroad. And it's an exciting one today because we'll get to talk about solutions. In the past, we've laid a lot of emphasis on what is not going right, what could be improved, and today we'll be shedding light on people who are actually having a real impact in the field, people who are bringing change. And our theme of today is just aimed to let everyone know that you're never too small or insignificant to bring change. You don't need to look up to someone else to be the change maker. You are the change maker. There's a proverb that says that instead of cursing the dark, dare to be the one to light the candle. And yes, maybe before we dive into all the exciting stuff we have planned for today, I'm just going to use this opportunity to welcome everyone and to say hello to our chairman. Hi, Dr. Former, how are you doing today?
Oh, Alison, thank you. I'm doing great. And it's a pleasure always to see everyone here. I can see you and Elvis looking very smart and bright. I think it's going to be a wonderful session.
Thank you, Dr. Former. And our chairman is calling from the hospital, saving lives in two fronts, both from the clinical aspect and from the public health aspect. And for today's session, I am accompanied by my co-moderator, who is not just the co-moderator for today's session, but the lead panelist and presenter for today's session, Elvis Dancy. Igwe, how body?
Body day good. It's a pleasure once again, ladies and gentlemen, to be with you. Whenever we are about to start a town hall, you can see us smiling from cheek to cheek. This is one of the best moments of the week. So happy to be here today and look forward for an exciting conversation.
Thank you, Elvis. I've been notified that some of our other co-moderators might be joining us just a little late due to competing priorities over the weekend. However, we're just going to go ahead and get started. So the topic for today is impacting healthcare in Cameroon. You can be a force for change. And as we were preparing for this session, we had the opportunity to reflect over current and past initiatives, both by members of the town hall and people who are not necessarily members of the town hall, but of the Cameroonian community at large, to reflect on all the work they are doing, that they've done, and they continue to do to improve lives. And truly, you can be an agent for change. You're never too small. And Elvis is going to be leading us in this session, shedding light on what has been done, what is continuing to be going on, and where you as an individual and me as an individual can support the system instead of being the ones to curse the darkness. Elvis, over to you.
Yeah, thank you, Alison. And when Muno thought about this session, he said it was time for us to think of the work that members of the town hall are doing at their different in their different fields. And so we said, let's try to showcase, our different work, just so we can know what each and everyone is doing and maybe know how we can support each other. And so Muno did a very great job to put together, a summary, just kind of just a gist of what some of the key members of the town hall, those who have presented in the town hall as guest speakers, and other people who are our fervent participants in the town hall, to just know what they are doing. And so Muno is going to kickstart this session by presenting or showcasing some of the impact work that members of the town hall are doing. And I will take over from Muno then just to showcase some of the work that Unite for Health is doing too. So Muno.
Thank you, Elvis, and Alison, thank you. Rather than this week, I thought about really getting to present updates in COVID, and I think we've gotten a lot of updates. The past 1-2 weeks has been quite quiet. So today I really reflected with Elvis and Alison that we're going to talk about where we are coming from and how each of us can be an agent of change and a force of change in Cameroon. So I would start by just thanking my moderators and founding moderators in the whole change we've been having in Cameroon Town Hall for health professionals. Elvis has been there from the get-go. This idea was really cultivated by Elvis and myself. We talked about this before ever making to light this program. And Alison joined us very soon as this whole idea started. But Elvis has been doing a lot prior to this, especially in fields I knew Elvis years back. When you talk about someone who wants to change things, I will not talk a lot about Unite for Health, Elvis. I know your passion is actually making sure that our mothers and our children get not to die while giving birth, and the child should not die while being put to birth. So this is really one of those things I applaud you for. I've been an admirer for what you have been doing for more than 20 years, and you know that we've known each other for a long time. And just recently, Elvis talked to me about, oh, Muno, Women's Day is coming up. I want to screen women for cervical and breast cancer. I'm like, wow, I'm an oncologist, but I'm not thinking about these things like this. So Elvis is bringing a lot of change. And I think Elvis is going to tell you with Unite for Health, which is going to be like a case study just to talk about what you can do to bring change and how change can start from your experiences and your different things you go through in life and how you can actually impact Cameroon. Now, on the other hand, Alison is a change maker by herself. And when you talk about vaccine hesitancy, when you talk about someone who loves data, who wants to drive change with data, then you should think about Dr. Alison Waye. So this is someone whom the town hall and every organization owned by Cameroonians can benefit from having her in your team. You are going to have someone who would drive the agenda with data. You would have an avid epidemiologist with great knowledge. Not forgetting the other members who actually are our moderators. I would start with Brian. Louisa, she came in with so much light into joining us. You have Christelle, who has been making our platform very bilingual, and Teresa. Looking at Brian, he may be young, but very impactful. Extremely impactful. I just chose one of his M&Ms. If anyone knows what an M&M is, it's mortality and morbidity. To publish an M&M in CDC, you need to be a guru. So Brian has several M&Ms, which is either the first or the second author concerning COVID. And Brian doesn't stop there. He has done a lot of proposals trying to make sure that Africa and Cameroon is not left out of trying to identify different variants. Brian has been working with CDC Africa, has been actually voluntarily giving them knowledge, trying to work with Cameroon to be able to identify new strands, new variants, and be able to make us feel protected, all those who are back home in Cameroon. And there are several links I put in this slide, which if you want to know exactly what Brian is doing at the level of CDC Africa, African Union, you can always click on them. But they're doing a lot of big work. Now, as I told you, I will not forget talking about Teresa, who is passionate about bringing change, both in research, the world of research, the pharmaceutical world, conducting clinical trials. Just through this town hall, she has gotten in contact with people like Kate, and I think there are big goals coming ahead. Driving clinical trials, driving change, and also trying to, Teresa is very focused on creating change that is sustainable, which is something I really appreciate. Now, if you know someone you want to talk about, be the change you want to see in the world, then you're talking about Louisa. A passionate physician who has given time both abroad and here in Canada, and has really put on a lot of work. She's doing her residency right now, but you can always talk to her to get the experience of being a physician back home and in the diaspora. Now, for Christelle, the first time I talked to Christelle, she wanted to talk about TB. She wanted to do a presentation on TB. She's an avid advocate on ending tuberculosis. And she actually explained this concept to me about you have to put your money where your mouth is. So she's one person who thinks that HIV, TB are not given enough attention, despite the attention they get, but we need to get to the point where we have vaccines for these diseases. We do have zero TB, and I think she's a co-moderator, but those who are back home who need someone in your team, she's a physician, she also a public health specialist. I think this is someone who is going to make a good team for you, and she's doing a lot back home. Now I'm going to go into some of the gurus that were here at the beginning of our town hall. Professor Wisonge has been with us all through this time. And Prof, if you hear about the Cochrane, then you know about Prof. Prof is involved in multiple research in South Africa. He has carried out multiple trials back in Africa. He has actually done multiple projects home, driving research. I know at least 20 Cameroonians who have had scholarships in South Africa just from Professor Wisonge, the ones I know, not talking about the people I do not know. And he's a big man, but always there for those who have small ideas, and he has been there with us from the beginning. Now, vaccine hesitancy, the two people who come to my mind are Professor Wisonge and Alison. I know you do have other gurus in this field, but Prof is really one of the biggest gurus when you talk about vaccine hesitancy in the world. And right now is the time for us to really tackle this topic. We had our trio here. These are people you want to know. So if you don't know Kenji, please try to know him after this presentation. You guys can make change happen. Those who have NGOs back home, Antipath and my man Terence Abor. So I'll tell you just a little bit about what each of them have been doing back home. So Kenji works at Stanford. He's in charge of the lab, research lab, and he has taken time back home to educate his fellow scientists, fellow laboratory scientists, even his professors about what is going on and how we can do to prevent pandemics going forward. And he has done this through several seminars, and Kenji doesn't end there. He does voluntary work back home and abroad. So, and if you are listening to the news, then you must have heard about Kenji. So please collaborate with these guys and let's make change happen in Cameroon. So I can recall this presentation, we're talking about Delta, then we're asking questions. Kenji told us it's not the end, and it was truly not the end. Then Omicron came. So I think during this discussion, it's been wonderful having Cameroonians who are bright minds and who have been directing us through this pandemic, through these 2.5 years, almost 3 years. And I just want to say thank you. For Antipath, we do have a field which I always want to talk about. She's an advocate for change, both change back home in Cameroon, projects that must not deal with health, but deal with human social change. She's also a leader into antibiotic resistance, which is going to affect Africa, affect Cameroon. And she wants to actually improve how our labs, quality assurance in all the labs in Cameroon. I think that's a passion she has. And any NGO which is working in that light should actually talk to Antipath, and we can walk a way forward. This is one of the most interesting I got to put in place, because if you look at Dr. Terence Abor, he is a scientist, but also he engages himself in debates that are non-scientific. And thus, I watch him almost every Sunday when he's live with what we call the big debate, Cameroon. They debate multiple topics. I just chose the 2 topics that dealt with health, and I put them here. And also there was the whole African Nation Cup. I could get updates from Terence. So please, if you're one of those who is here and think you want to spend a Sunday really getting knowledge on different fields in Cameroon, I think you should actually listen to Terence. Now, we did have certain surgeons who came to our platform, and Dr. Tim Fabrice and Dr. Ignatius Essene. Essene is a neurosurgeon. He is the president of the Young Neurosurgeon Association. And really, this being a Cameroonian, I'll tell you a little bit about what he has done. he actually ignited the love for neurosurgery in Cameroon by getting models that were sent to Cameroon in all the universities, and students had to actually practice how to do neurosurgery. The love for neurosurgery was reignited in Boya and in Bamenda. So don't be surprised in the next 20 years coming, we'll have hundreds of neurosurgeons back home because of what he's doing. He's a real model that everyone wants to be like him. Now, there is something about being selfless. This is one of the people I know who is completely selfless. And Dr. Tim Fabrice works with Ascovim. If you all know Dr. Boele, they have been carrying out what I called surgical eradication of certain diseases that you can do in Cameroon. Hydrangeophiles, patients with appendicitis, appendectomies, patients with complex surgical benign masses. Basic surgical skills have been taught to a lot of doctors in Cameroon, a lot of nurses, just through their advocacy and education. And Tim also volunteers his time in teaching, actually voluntary time, at University of Boya, University of Bamenda, where he does impact knowledge, which is not where there is a knowledge gap. This Dr. Clarence is a friend of mine, passionate, and I really want to advocate here that once you have someone who has a team, Cameroonians are notorious for not wanting to help each other. Clarence has always wanted to make cardiac surgery available in Cameroon. He's in Germany. He's willing to work with any organization. I have his contacts. He has a team where he can actually help adults and children who have complex cardiac problems and are unable to actually get surgery. So please, these are all things we need to think about, know the people who come and log into our town hall. I think all of you know Dr. Boguma Titanji very well. She's been here multiple times. She has one of the best TED Talks, if you have not heard about it, advocating for research equity in HIV and in the world, including Black people in research. She's a virologist. She's an infectious disease doctor, knowledgeable in several things. Just to give you, every week, I think Dr. Boguma is presenting something in one big university. This week, I was just looking up. On Friday, she has a presentation, which is actually looking at COVID-19 vaccines and failed promises of global solidarity, really talking about how Africa and others have suffered from the lack of global solidarity in order to provide vaccines to everyone. I could not forget Dr. Ivor Dita, whom I think is one of the reasons I'm actually sitting here. Once you move to a country and you have people who can support you, Ivor is a gastroenterologist and also a big advocate in Cameroon to provide healthcare for the basic man, meaning he puts his money where his mouth is. And also trying to, he was here talking about colorectal cancer and trying to see how we can get diagnosis and screening, make colonoscopy available to everyone back home, and know that we have these diseases, just that we are unable to diagnose them. The other day we did have Innocencia Kuala, and this was an eye-opening presentation to me, which is Kiara. They won a second prize in the Novartis competition in Africa. They do have nurses all over Cameroon, and it's really advocating for nurses, midwives, and my mom is now part of this service. So I would like to encourage everyone, and I got a wonderful report about my mom's healthcare, not from the doctor, but from the nurses, and what she would really need and in order for her health to improve. So I think this is something each and every one of us can create, either an NGO, an organization back home with the goal of actually helping people back home. We did have Dr. Chang Taka, who was one of our presenters. And one of the things is that you want to know is his good at providing education to the basic man. And Taka was just live at Living Africa. I put this here because it's a podcast I would want everyone to listen to. So Anyon does a podcast, I think every week, about different issues in healthcare, and also not really just different things in life related to Africans and those from African descent. And it will be very interesting. I was there, I talked about breast cancer, and I've really listened to and gotten education from this podcast. So it's one person I want to highlight while talking about what Taka does for a living. Taka is mostly engaged in education and supporting back home. We were the first, I don't want to say the first, we brought You Farmer here. I think at the time, You Farmer, it was an idea, but right now they're operational in Cameroon. For those who are interested, I think we're going to re-invite them sometime, Elvis, to see exactly what is going forward with the idea of You Farmer. And through this service, you're able to actually pay for prescriptions for your loved ones back at home. And even back at home, you can pay for prescriptions for others in other areas and actually pick it up in pharmacies. Just a few weeks ago, we actually got mesmerized with what AI can do. How we can change artificial intelligence is going to change the world. Either we accept the change, or we just know the future is going to meet us. So the future of healthcare is actually in investing in artificial intelligence. So I think this is still fresh in our minds. What may have left our minds is almost a year ago, we're talking about sickle cell. We brought two strong advocates who are also living with sickle cell. And it's courageous for them to come in and tell us about how they feel. One is a physician. The other one is actually an advocate. Echi is an advocate and also a social worker, and she can actually help you go through a lot. And I've admired her for years now. If you want to know about Echi, you can see from the different prizes she has won in different fields of life, not only advocating for sickle cell, advocating for the deaf, advocating for the underprivileged. So she is one person, if you're thinking about doing work in Cameroon, you should actually contact her and work with her. Things will get done. I think this was one of my best. Rural doctors, it just made things different for me. I just realized how the young can bring change. Truly, I was taken by surprise how much a young person could organize and could come up with an idea and make it so sustainable. So when you look into the news, each time I just Googled this and I saw rural doctors trying to doing HIV screening in Limbe, in Bamenda, rural doctors fighting cholera in Douala, rural doctors helping the displaced in Menchum. So it's like they're everywhere trying to change. Pain management was another topic we did talk about. And the moderators can actually remember this day when we had Edwin here and Venatius. They are members of a wonderful organization I want to tell you guys about, Association of Cameroonian Nurse Anesthesists in the US. They were in Cameroon back in December, training nurses on basic anesthetic skills and even doctors on how to intubate, how to extubate patients. And I think this has been a very great skill. So we did also have Eleanor who was here with us. Eleanor actually does education on ophthalmology. And she has a YouTube podcast I listen to a lot of times because there are a lot of things I learned. Being a physician, there's not much I know about the eye, and you cannot believe this, but Eleanor, and she delivers it in pidgin English. It's so great that I would encourage everyone to go watch them. I don't know when she has the time to do all of this. Not forgetting Dr. Wingo, Dr. Folak, and you also have Amandine. They were here talking to us about malaria. If you want to know someone who believes in wanting to appreciate what we have and work in order to, you just cannot spend your time condemning things without knowing what are the benefits that you have. I think Wingo is one of those persons who wants to build on our successes and get an integrated healthcare system, not just getting projects that are sold to us by the diaspora or by big organizations which are not sustainable. And if you think about stopping malaria, the first person I think about is Dr. Fola. He has been doing this for many years, and I just want to say thank you to him for everything he's been doing. We had a session where we did talk about improving access to sustainable radiology care in low income and low resource countries, where we met Dr. Foyon Kennedy, who talked to us about MedRat and how they helped the Baptist Hospital, Bingo, and several other hospitals to be able to have sustainable imaging centers, which our big hospitals like CHU could not have. And they have been able to sustain this for quite a while. And he's involved in also reading X-rays, reading MRIs with experts in Cameroon, and helping in the training of radiology residents. I know a lot of you will be like, oh, I may have forgotten some people. I don't. So you do have Dr. Judwing, who has been with us since from the beginning of this. And you have Dr. Lucas Esong, and they did talk to us about infant mortality. Esong has several projects running in the extreme north. He's in Marwa. For someone to leave La Cantini and go to Marwa and decide that is where you have the problems in Cameroon, malnutrition, that is where you have infant mortality being the highest. And Esong is there working with the government, has multiple NGOs. They are trying to help these children get to at least see their 5th anniversary. Now, when you talk about Judwing, you talk about a woman who is strong and wants to bring change. Through her, I got to know about Cam Doctor UK, which is an organization I would want to tell you among all the diasporan organizations I've seen of physicians is one of the strongest. They have had an impact during COVID. They provided masks to multiple hospitals, provided equipment, provided several things throughout this pandemic, which has been of help to the Cameroonian nation overall, and especially to the Anglophone regions. Now, Dr. Yauba is actually the acting director of the Clinton Health Initiative, and with his busy schedule, he still made time to come talk to us. What has Yauba done so far? His leadership has led to Cameroon actually being able to have access to oxygen, access to the vaccine itself, the COVAX initiative, they were part of it, received the vaccines several times that came to Cameroon, ending cholera in Cameroon. This is a guy who actually means change. Those who are working back home, you have to liaison with him in order to make sure that change is going to happen. So Christelle, I told you Christelle was here with us with End Tuberculosis 2030. The presentation was done with Christelle and Crespo. What do you know about Crespo? Crespo advocates for TB also and has a YouTube channel, which I would like you guys to go watch. It's actually telling you about life in Japan. So Crespo is one of the Cameroonian doctors who is working in Japan and tells young people on how to get into residency there and see exactly how medicine is done in Asia. Now, I almost forgot my dear sister. She's my sister, so she works in the big pharma. And if you really want to know how big pharma works, maybe you talk to Dr. Mafor Ayok. She will tell you exactly what happens there, and she's an advocate. Dr. Lekubu came to this program. He's my mentor, and I think I am here today because of Dr. Lekubu. He knows how the system works in Cameroon. He knows how change should come. He's a humble guy and believes that you need resources that are adapted to every environment to bring change. So we did talk about stroke back in the days, but his presentation was so practical. Another mentor of mine was Professor Alemji, was here to actually talk about global health system strengthening. And I think this is one of the most important lectures so that we don't concentrate on COVID and forget that other diseases are existing. And Prof. Alenji works with the CDC Atlanta. He's a senior technical advisor there. Dr. Agui is Samuel Agui, sorry, is one of the people in Cameroon where if you're talking about mental health, then you need to be able to liaison with him. He's bringing a lot of change in mental health back home and has multiple consulting clinics where he's helping people who have schizophrenia, people who have bipolar disease, those who are mad, and bringing them and integrating them back to life. And also getting our young boys and even girls from the street who have been taking tramadol and actually rehabilitating them. Dr. Ojong has not been here for a while, but you know Ojong is an advocate of protecting female health. Ojong spoke to us about cervical cancer. You do have Dr. Jean-Claude Kate and Ferdinand. Also, one of my best presentations was on diabetes. Really defining it. Kate has an NGO back home. Kate is a member of a Christian organization back home. Kate also does research which is adapted and has a research team back home. So here is a group of gynecologists you would hear about, especially Dr. Umbaku Kingsley and Dr. Ojong. Change is going to come to Cameroon. These are great minds who are going to bring change. So I just want to thank them for actually sacrificing their time. So Elvis, I may have forgotten a lot of people. I really did not want to take this much time, but this is just to say and to show you that we have a lot of people who are actually in the town hall. I decided to leave those who are out of the town. There are a lot of people out of the town who are bringing change. And there are a lot of people who are participating in the town who have left out a lot of them, but maybe next time we'll be able to include everyone. Thank you, Elvis.
Yes, thank you so much, Mono. And you'll agree that we are 1,234 now in the town hall, so you can possibly present everybody. And you decided to select those who have actually come forward and done a presentation here at the town hall, just to put it in context. And we really appreciate, coming up with that kind of a rich summary. Alison, what's your take on that?
I know, it just left me feeling so emotional and just realizing that a lot of times we're looking outside for solutions when we actually have them in-house. Imagine the richness, just look at the richness of the team, the richness of all the presentations we've been having, the diversity of the different areas where people are working. It's just so impressive. And I see Teresia is with us. Hi, Teresia. Oh, looks like I think your microphone is muted. Yeah.
Oh, hi, everyone. Hi, Alison.
Welcome. And, for those of you who hadn't had the chance yet to meet Teresia, this is the dynamic, powerful lady who is trying to turn, the majority of scientists who usually have very tunnel visions into more visionary people. And Teresia has just joined us a little late. So we are about to, take this presentation, make it have a different turn. It's still within the context of what's happening in our country around change in the healthcare space. But now we're going to be zooming in on a specific organization. And this is one organization amongst many doing a great job. But the reason we zoom in on this organization, which is called Unite for Health today, is because they really are outstanding. They're handling issues which are sensitive, issues around maternal and child health, which are really, really important and crucial in our context. And their work has been very impactful, and they've got a very strong leadership handling this organization, and they've proven in the past that they can take tasks and deliver them. And we're going to be learning a little more about Unite for Health today from our very own Elvis, who is Oga at the top for Unite for Health. And we're excited to have him here talk to us about this organization. Elvis.
Thank you, Alison. Can you imagine, since we started at the town hall, this is the first time I'm putting up a slide. We always talk, and now it's my turn to do what Muno does every time.
Yes, so today
So
we
it's a
put you on
great
the hot
pleasure.
seat.
Can you see my slide?
Yes, can you put it in the presenter mode, please?
Okay, let me put it in the presenter mode. Just a moment, please. Can you see it?
Yes, we can.
Okay, let me go here. All right. So I'll take time to talk about Unite for Health Foundation. And when Muno and I talked about presenting this work, we just had a conversation, and he said, we need to talk about what town hall people are doing too, just so we put in context some of the things we say when we moderate and some of the things we stand for when we actually raise our voice to say the things that are not going well back home, but to see how we can contribute in our own little way to make things better. So I'll walk you through a little, story and journey of Unite for Health Foundation, just so we can see how far we've come up to this point in 2022. So the mission of Unite for Health is to combat infant mortality and fight infectious disease and non-infectious disease as well by providing affordable healthcare and education to underserved communities in Africa. And we reach out to people using our microclinic model. And we recently added telemedicine as well as our mobile outreach program, which will help us collect data that can inform public health research. So this mission has been refined over time. And I would like to tell you that Unite for Health Foundation has really been steadfast to the core aspect of its mission, which is actually maternal and child health. So just to tell you a little bit about the story, Unite for Health Foundation was founded in 2007 and registered the same year in Yaoundé, with a head office in Yaoundé. So just to paint a little story, I will start with the I, which is myself, before I go to we. I earned a bachelor's degree in the University of Buea in 2006. And Alison, you can see how old this guy is. So I was offered a work by the Ministry of Public Health to work in Bakassi Health District at that time under the HIPC form. At that time, Bakassi was still a disputed zone between Cameroon and Nigeria. So it was a no-go area. People were scared just to even hear the name, talk less of being sent there to work. I took the challenge. The first day I was going to Bakassi, I remember there was crying in the house because they knew I would not come back, but I had to go there. So while in Bakassi, at that time I was just 23 years old, but I had to take that challenge. But when we talk about the realities on the ground, I would say that I have been there, so I know where the shoe hurts. So the pain of going to Bakassi was inexplicable. There was just one land road that led to Bakassi. Either you go by sea or you go by the single road from Mondemba to Esangele. So most of the time when we reach Mondemba and there is no boat to take us to Bakassi, we have to go by land. And this journey took us almost 48 hours, a journey of less than, I think, less than 30 miles. So accessibility, that's one of the time I started learning about access to people. If you cannot meet them where they are, if you cannot reach them, then you cannot help them. So I came to realize that this is true. If you can't go there where they are, you cannot help them. And we listened to Dr. Samwe present, and this was a similar kind of a story of people living in far last mile area. And if you can't reach them, then you cannot understand how access to healthcare is difficult. We used to sail across the creeks, the dangers of the high sea, just to go give, immunization and vaccines to children or deworm them. And sometimes we had to be escorted by the military because it was a war zone. So there were pirates in the high sea. And so we had to move with the military. At times they will even want to teach us how to shoot in case it is necessary, but I never shot any round of that rifle there. So I say that sometimes inspiration is a product or outcome of painful experiences and adversity, and this depends on how you look at things. there is an adage that if you look at things differently, the things you look at will change. It just depends on how you see things. So the challenge pains I personally endured while working in Bakassi, and the inequality in healthcare and the suffering of the people in the underserved community is what actually ignited this passion in me. I decided that, yes, I have to do something about this. And so then the journey started. How will you start if you don't have money? While a 23-year-old in Bakassi, I had a photocopy machine that was still left in Boya and was doing some work for me to give me some income. So I decided to sell that photocopy machine. Then I relocated to Bonamusadi in Yaoundé, where I rented a single room, bought some stethoscope, box of medication, and rented a one room in a building in Bonamusadi, the student residential area, and started something, consulting people, treating for malaria, typhoid, and skin rashes. But then the challenge started coming. Because they know you are treating people, then you see somebody coming with severe malaria, you need to hospitalize, but there is no bed. Then you start thinking, oh, I need another room in order to admit people. Then you see somebody coming, they need to run a test. Oh, okay, then I need a micro lab where I can at least see if this person has malaria or not, or if this person has this infection or not. So then a micro lab develops. I had to register it as a nonprofit now because I started seeing that, oh, this work I'm doing, it's not just about money, it's about passion. Why? Because at that time I was more involved in business now. I've just left work. I was trying to make money. I would travel to China, buy medical equipment, come sell to Cameroon, but all my profit was going to this work. So I knew at that moment that the point was not money. The point was just the joy of helping people. So that's why I decided to register Unite for Health as a nonprofit. So the demand from the population started coming, and that's what pushed me to the idea of a micro clinic. Before I could see, I had already created a micro clinic with a little consultation room, a mini lab, and some 3 beds, and a small little space for pharmacy and other things that could, and there was no other space that you could do anything because we were limited. I understood what I wanted to do at that point in time, and this was to provide access to healthcare in underserved communities. And this was to be done by way of opening microclinics. And this was because while in Bakassi, I could actually see how people would trek from Kombo Abedimo to Esangele just to gain access to our health center that was in Esangele. So people don't need to walk for long distances just to have access to basic healthcare. So if every community can have even a microclinic, then you will be solving a lot of primary healthcare problems. Then at that point in time, I knew I needed a team. If you notice from the presentation, I've been using I, but then the I stopped at this point. I needed a team. So I looked for some friends and we started to model these ideas together and to expand. 2 years later, we opened the second branch of the microclinic in Bamenda. 10 years later, we opened the third microclinic in Elumdem in Bankomo. 12 years later, Unite for Health Foundation was registered as a nonprofit in the United States with the headquarters in New York. 15 years later, this is me here doing this presentation. So it's been a journey of over 15 years. But let's look at what is it about Unite for Health Foundation? What do we do? So we have come to refine our work in 4 areas of interest to us. The first being the microclinic component of Unite for Health Foundation. And this idea was we can use microclinics to reach out to underserved communities, to last mile communities. So we have to open microclinics and have people have access to healthcare where pregnant women can have access to give birth in the hands of skilled healthcare personnel in a microclinic. But with COVID-19, we had to add telemedicine there because at some point we saw that people have to call and consult when they could not come to our clinic. I will talk more about that. We also have the community health outreach program. We said if people cannot come to the clinic, we need to take healthcare to them. So we have to do mobile outreach campaign. Then of course, research and innovation and professional development of our workers. So these are the key 4 areas that Unite for Health Foundation is operating in. Now, let me start with the micro clinics and telemedicine. So at our micro clinics, we provide general consultation, preventive care, women's health, circumcision and treatment for diagnosis and treatment for basic infectious and non-infectious disease. But of course, we do a lot of referrals. And so we have our micro clinic has a small laboratory that is able to do full blood count, HIV tests, hepatitis B, malaria, typhoid, all the basic tests, urinalysis that you can do in a small lab. We have a unit that provides pro-pharmacy with all essential drugs that are listed on the essential drug list in Cameroon. And we always provide hospitalization space where we can actually, administer infusions for those with severe malaria. And we added a delivery unit, a maternity unit, making sure each of our microclinic has a space where a woman can give birth. Why did we do this? It's because at the time we started the clinic at Bonamusadi, we had just 3 beds, which was just meant to hospitalize patients. But we realized because people know in the community that this is a clinic, at night a woman comes in labor and she's already crowned, and you can refer her because at the stage she's coming, you need to deliver that baby. So we had to provide that space to take care of such emergency. But of course, maternal and child health became the very key component of our existence and of our programs. So some of the clinic, like the clinic in Bamenda, has a minor lab theater where we can do surgical interventions like cesarean section, hemorrhagiosis, basic surgeries. And in those clinics, of course, we provide health education and counseling, especially reproductive health and family planning. We've partnered with ACMS Cameroon sometimes to do reproductive health programs with women, especially in the Yaoundé branch of the clinic. So we have an ultrasound in the Bamenda branch of the clinic, which also help us to provide quality antenatal services to pregnant women. And our ultrasound, to do an ultrasound in Cameroon for obstetric ultrasound, for those who know it, is minimum of about 7,000 francs. But I think ultrasound at Unite for Health Foundation is 3,000 francs. And the point was because we want to make sure that there is accessibility and limited financial barrier to women. A reason being that the ultrasound, of course, was donated to Unite for Health. And so since it was donated, we have to cut down our cost by more than 50% so people can have access to this. Now, what was the vision of this microclinic? When I was at Columbia University as an Obama scholar, I thought about what is the way forward for this microclinic. So I had to partner with some students in the School of Architecture to come up with a design of how this microclinic should look like, incorporating other services that we were not yet offering. But we wanted to have a unique structure that if you see a microclinic in Bamenda, it should be the same microclinic for Unite for Health in the north. If you see one in Bakassi, it should be the same you will see in Misaje or in Bali. So we wanted to have a unique design. And so this is the design that we kind of conceived and take into consideration our culture and all the different aspects. And there are some certain power dynamics that plays in the infrastructure of a health unit that I only learned that recently. And if you kind of think through that with in your infrastructure or design of your health facility, and then you can understand that you can be solving a lot of problems indirectly just by the kind of way you design your microclinics. And so this is the design we have. And I always say that Unite for Health is open. If you want to open a health facility in your village to help your people, you can partner with Unite for Health Foundation and we'll replicate this model for you in your village, because we've done this and we know how it works and we know the challenges and we can help you get this done. But we had to think in a sustainable manner. We want a microclinic that is powered by solar and also self-sufficient in terms of water. And so in our design, we think of sustainability, making sure that there is water that is by the borehole drill, but powered by solar energy and then provided to the clinic, so that at any point in time, we cannot say there is maybe water shortage because of CAM water, or maybe a lack of electricity because of a nail. So we already had that in the thinking of our microclinic design. So if you want to help your village to have a microclinic or to have a health facility, Unite for Health is ready to work with you to make that happen. Now, what is the impact of this microclinics? Over the past 15 years, we've consulted more or provided access to healthcare to more than 30,000 Cameroonians, and more than 500 babies have been delivered in our microclinics over this period of 15 years, but with 0 maternal death and 0 child has died in our clinic. This is not to say that when people die in the clinic is because, or in the hospital is because the hospital is bad, but I'm just proud, of course, I can't help it by being happy that we have not recorded any maternal death in our hospital, and this is really great. There are some links to which I think Alison will share with you. You would see in 2020, we decided to help reach out to almost 100 internally displaced pregnant women. We had a program that was financed by the, through the efforts of the board of directors here in the United States to give opportunity for underprivileged women who are pregnant to give birth free of charge in our microclinics. We assisted a lot of women to pay for their birthings, making sure that they're able to just give birth free of charge, take their beautiful babies home without paying anything. You can't imagine the smiles on their face when you tell them that you are not paying anything, your bills have been paid. Such a big relief for a woman who is thinking about what they're going to eat the next day. So this was a very great project, and it's still going on. We always still reach out to some of those women that have challenges. Now, the second aspect of our work is a community outreach program, which I talked about. So we do not wait only for people to come to us to benefit for healthcare. We want to take healthcare to them. And these are the words of one of my board members, Kenji, during one of our board meetings in the heart of COVID-19. We're worried about the fact that COVID-19 made it difficult for people to get to the hospital or to the clinics because of all the rumors and propaganda that was going on, and people were scared. So Kenji in our board meeting said, if they cannot come to us, let's go to them. And so we started thinking about community outreach programs. So we have carried over 100 community outreach programs as of now from the past 15 years. We started doing this while in Yaoundé by just organizing free screening for hepatitis B, free screening for HIV, free screening for this, community outreach for this. But now we come to really think that this is a core component of our work. And so now we are screening for non-communicable disease in Bamenda. We have been able to screen last 2021, we screened a lot of people, and we kind of had interesting findings. For the population we screened, we realized that 41 of them, 41.6 were found to have stage 2 hypertension, and 41.2 were found to have clinical obesity, and 12% were found to have diabetes. These are people who didn't know before just coming for a clinic. We did this in churches. We did one in Tabesi Church and some other churches. So we just go to the church, organize a mass screening, and people come. And these silent killers are important. And the reason we choose diabetes, hypertension, and obesity, because these were serious comorbidities that were actually impacting the severity of a COVID-19 disease. So we wanted people to know their status so they could take action. And to honor the International Women's Day, we are offering women free cervical and breast cancer screening in Bamenda. This is actually going on. We started on the 5th of this month. This is our branch of the microclinic in Bamenda, and the campaign ends on the 31st of this month. So if you have relatives or friends or family members around Bamenda whom you want them to go screen for cervical and breast cancer, they are welcome. So far, I just got report that 50 women have been screened already, and this is free of charge. They are not paying any fee. It's been sponsored by Unite for Health Foundation here. So we've also done screening for HIV, hepatitis B and C, and that especially in the Yaoundé branch, because the Yaoundé branch is found in the student residential area of Bonamosadi, and so we always focus a lot on sexually transmitted infections. We've helped a lot of students to know their status and actually treated a lot of them who tend to be positive for certain things like syphilis and basic infectious disease. So during the COVID-19, the peak of the COVID-19, we started doing some kind of humanitarian work, just distributing masks and soap in the community, helping people to, understand how COVID-19 is being transmitted, encouraging people to do hand washing. And at that time, masks were very scarce. It's not like now where you can just get the mask and nobody even want to get it. I remember there was a time even to get a mask was not easy. That's when we had to send our team around the Bonamosadi community and in Elumde at that time to distribute masks to the community, just to our own contribution for the fight against COVID-19. So the third aspect of our work is the research and innovation. And of course, we heard from Dr. Emmanuel Fombo. If you are in healthcare and you're not thinking about innovation in terms of technology, you'll be left behind. And so Unite for Health Foundation does not want to be left behind. So we started by just making sure that people could call using their phone, maybe WhatsApp video calls to consult at our clinics. At the time, COVID-19 prevented people from going to the hospital. And we also collect data from our laboratories and all the different aspects of care. And we believe that this can be fed into technologies and ensure accurate screening in the future. So we are thinking through different things that can help us innovate. So we created a telemedicine program. As you can see, there was a banner in Bamenda all around with our numbers, and in Yaoundé and in Elumdem in Bankomo, we had all our cell phone numbers of the clinics open to the public, and that they can call and consult with the doctors. And the doctors were paid extra money to sit and receive these calls and make these consultations. We realized that calls were coming from different parts of the community. You have a call coming from Boya, you have a call coming from different parts, because we also did social media campaigns. So not only those who were in Bamenda, in Elumdem, or in Bankomo were calling the clinics, those in other communities who had the numbers were calling. And during that period, we actually offered healthcare to a lot of people just by phone call. And that was, but there were challenges. And I would like to say this: if you are thinking about doing telemedicine in Cameroon, the challenge is the cost of data. I mean, somebody will call and the airtime is finished and the doctor has to call back in order to continue the consultation. So we ended up spending a lot just calling people back to continue to complete their consultation. So a lot of people cannot afford the cost of buying airtime or data to stay on a complete consultation that may last sometimes for like 10, 15 minutes. Now, still talking about innovation, we are introducing, Unite for Health Foundation is already introducing a mobile app, and we want to handle some key issues. The issue of blood donation. We realize that a lot of times people need blood transfusion, they call for relatives, friends, and they come, it's not their blood group, or either they refuse to come. So this app is going to link blood seekers and blood donors to be able to actually get unique donors when you get them. And so we just had another meeting this morning with some board members and our IT expert to think through this process and what we want it to be. And of course, we're also thinking of having a maternal and child health app just to be able to help women to go through the journey of their pregnancy with a lot of information and reminders and trackers that will help them actually easily diagnose things that are wrong and give them signals to take action before any complication sets in. Now, the last aspect of our program is professional development for our health workers. The quality of healthcare depends on the quality of training that healthcare workers have. And because we hire doctors, nurses, and lab technicians, and midwives, and community healthcare workers, and other volunteers, I think training is very important for us, because if we don't continuously upgrade their knowledge, then their quality of service will also be impacted. So we plan to move now away from just having seminars with our workers, but but including other people who don't work with us. And so we would do this in partnership with other people that are doing similar work, maybe organize some training, some seminars, and just to make sure that healthcare workers keep their professional development and skills abreast as the days go by. So this is the aspect that we are thinking through as part of our work. At the end of the day, all this is just about teamwork. As I said, I started a presentation with I, and you hear me at some point, I transitioned to we, and it's all been we because it's teamwork. If I'm blessed with an amazing team of doctors, nurses, lab technicians, and community healthcare workers and volunteers, and a great support from friends and families and those who donate to help this cause. We'll continue to do this work. We think the journey is still very, very long, but of course, when you are blessed with an amazing board of directors like the ones I have, then you can be sure that your vision will be big and the steps will be simple to take. I have an amazing board chair, Florence Buchanan, who is here in New York, and our treasurer, Dr. Robbins, whom I saw him on the call. He's on the Zoom call. Thank you so much, Dr. Robbins, for dialing in. Toka is a very, very, very big lover of Cameroon. He's been to Cameroon several times, and Cameroon means so much to him. And so he is really committing a lot of his time and efforts to see that the mission of Unite for Health Foundation is realized. We have other board members like Dr. Monica, who is at Well Cornell Medicine. Ghana Fofang is a Cameroonian. Also, Dr. Noshin is a hemato-oncologist working at the Cancer Institute. We have Kenji, you know him already. We have Ben Damash, and of course, Joe Magan is a Cameroonian working with IBM. These are some of the board members that sit together to think through the future of Unite for Health Foundation. I always say that above all, I know there are a lot of people who are angry with home. They are angry with what is going back home. You are angry with the system. You are angry with the government. You are angry with the politics. But above all, love is caring for each other, even when you are angry. And sometimes I behave like this guy. Even when I'm angry with Cameroon as much as I am, I still want to shed them from rain. I still want to do something. I still want to help my country. And I think that is the spirit which we all should have. And I would always say little be much, if little be all. If you not get the small way you get, you share with your people. That means a lot. Sometimes people really don't care how much you know. People just want to know how much you care. And the Professor Wilfred Bacham used to say that your life example and impact you create in people's life might be the only Bible that someone somewhere will be able to read. So thank you so much. And this is just a little story of our journey and the work that we've come by so far. Alison?
Thank you, Elvis. And for those of you who've just joined us, I think this is actually the right time now to give you insights around who this person who's been talking to us is. And, you know, I've had people text me and be like, how do you get to be so impactful? How do you just get to be as dynamic as Elvis? Like, what route has he taken in his life that makes him such a powerful and influential person? How do you get involved in politics at such an early stage in your life when many of us can barely even talk to the senior politicians home, despite the fact that we've grown and we've gone out and we've experienced life? So for those of you who do not know Elvis, we could probably sit here all day just talking about Elvis and the great work he's doing and the impact he's having in our individual lives, as well as in our communities, home and abroad. Elvis started off doing nursing at the University of Boya. He holds a bachelor's degree in nursing as well as a master's degree in nursing. And you're wondering, how did someone leave from nursing care to start getting into leadership and public health and all of this? So in addition to his master's degree in nursing, Elvis holds an MPH from Euclid University, and he's gone ahead to take several other professional courses, including public administration and social service professional training at Columbia University in the city of New York. And he also holds an international associate degree in civic leadership from Wagner College. Now, that's a little about what his education has looked like. With regards to his professional as well as his political and public health and research journey, it's just amazing. Elvis was a Mandela Washington Fellow in the year 2016. That's for what he's been doing with regards to like other trainings in this sphere. He was an Obama scholar in 2018 to 2019, and then he's currently the founder and CEO of Unite for Health. In addition to this, Elvis has actually done a lot of work back home in politics, and those are things that we would always love to have a bit of a bottle of something. I'm not going to say a beer, it could be water, to be able to talk about some of Elvis's political experiences back home. But trust me, this guy is one person that shakes hands with some of the biggest people as well as some of the smallest in your eyes. And he is the one person who understands a lot of our health systems as well as our policy arena, home and abroad. And for those of us who are sitting here, maybe who have, whether it's financial resources or human resources or material that we want to donate, and you're wondering, you want to give your resources and put them in the right place where you're going to have the impact you want, you might want to consider partnering with Elvis. We've seen firsthand the impact of the great work he does. Elvis, thank you once more for this great session, for presenting the great work Unite for Health is doing. And thank you to all the board members of Unite for Health who are able to join us today. And we hope that we would have you in subsequent sessions. And yeah, so I think at this point, we're going to open the floor for a few comments just to test the waters and see how the temperature is feeling. And before we start, yes, Elvis.
If you want to permit me, with your permission, I would want Dr. Robbins to just say some wise words. He has some nice words here he will always share, even on his Facebook page. And Tucker, if you don't mind, just saying a word to the town hall. It's one of the board members.
Thank you. Well, I'm tearing up because for 30 years I have worked with the arts of Cameroon. And I have seen the devastation of the conflict that's happening there. And so I sought a way to work for peace. and I was introduced to Elvis. And with great pleasure and great pride, I work with him in bringing recognition to the good work that you're doing and that Unite for Health has been doing. And I'm a big supporter and really appreciate all that you're doing for the people of Cameroon, all of you. So thank you, and peace, may peace prevail. Thank you for this opportunity.
Thank you so much, Dr. Thanks a lot.
Thank you. And Dr. Robbins, Mr. Robbins, maybe before we let you go, just a quick question. Has Elvis ensured that you've tasted at least one Cameroonian dish? Like among, we are very diverse in terms of food.
I've had a wonderful time in Cameroon.
Okay.
I've visited countless times, and I've spent a lot of time in Oku and Fuban, and I've got the privilege of having good friends within the Nijoya community in Fuban. And one of the princes died in my presence here in New York, and I've nursed his children. Yes, so the food is food's good. Of course, I'm a vegetarian, so I mean that's another story. But
okay, now I get it. Okay. Yeah, being for us, usually you don't see many Africans. Cameroonians especially, we love meat and our food is quite varied. But we do have some really good vegetables. Maybe the next time you get to visit. So in the Northwest, if you've been to the Northwest part, we have fufu corn with njama. So njama is like this nice vegetable. I know the people in the other part, like the Mancon people, are going to be hitting you and they're going to be like, no, you should tell him to taste achuba. Achu has a lot of meat. Stick to fufu corn and njama, or to Eru if you go to the Southwest, or to Ndole if you go to the littoral. You would never go wrong.
No, I love Cameroon very much.
Thank you very much, Mr. Robbins. It was such a pleasure having you. I noticed our other co-moderators joined. Hi, Brian.
Yeah, hi, Alison. It's really, really inspiring hearing about Unite for Health and the journey from the beginning. It's really super inspiring and really, really proud to see all the progress and work that has been accomplished over the years.
Thank you.
Okay. So we're going to now open the floor up for questions. And for those of us who have not yet checked out the Unite for Health website, please, you should check it out. We're going to drop the links. We've been dropping the links in the chat and we're going to do so again. And if you have not subscribed to their YouTube channel to see the great work they're doing in our communities, please do so. Subscribe to the channel and follow them on YouTube just to have a sense of updates around their activities. And for those of us who are thinking of maybe collaborating or partnering or supporting Unite for Health initiatives in any way, you can either reach Elvis directly, or you could reach out to any of the moderators as well as the chairman of the town hall, and we could always put you in contact with Elvis. So in the meantime, are there any comments, any questions from any members in the town hall? You can either indicate with a show of hand on Zoom, or you can drop your questions or comments in the chat. And I see CamDoc UK, commenting and texting us back and forth. Hi, Judwin. Is Judwin still there with us? Okay, maybe while waiting for Judwin to unmute herself, I see Dr. Kenji's hand is up. Hi, Dr. Kenji, how are you today?
Hi, Alison. Hi, everybody. Good morning. I'm doing great. At least the number of COVID cases is going down and it's giving some breathing time for us. It's really not all the time that I have the opportunity to acknowledge the work that Elvis has been doing in public. You know, we talk in the background as partners in crime. But, you know, in a public sphere like this, I think it's very good for me to highlight, you know, what he's been doing in the background. Many people don't know that when I finished high school, I wanted to be a musician. I didn't want to be a scientist. So maybe at this time, I probably might not have been in the town hall. I should have been in the studio cooking some beats. Elvis is a person that came to our house, I remember very well, and told me about the Faculty of Health Sciences. And I told him, no, I'm going to do music. And he finally convinced me. So If I'm in science today, it's really thanks to Elvis. He has been a very big mentor in my life. I've gained a lot of courage from him. He is one of that guy where if he says he wants to do something, he goes for it. I don't know where he gets the courage from, but he's been doing it, and he's been, encouraging most of the youth and being a good example. From politics, which I always, make a mockery of him that he failed woefully, not winning the parliamentary election. But I guess that was a very good experience for him as well, going through that. And also Unite for Health Foundation. I remember when he told me he's starting the clinic, I was like, you really want to start a clinic? Because most of us young guys growing up in Cameroon, that's not something that we would think, right? We just know that you finish from school, you get a job, you work. But Elvis, I just want to thank you, in front of everybody for the good work you've been doing, especially with Unite for Health Foundation. We are strongly behind you. You can count on our support. Thank you so much.
Thanks a lot. Thank you. It passes blood into my heart to hear from you. Thanks so much.
Okay, sorry, looks like we had a bit of interference. I'm just checking to see. Okay. So no, thank you for those comments, Kenji. We truly appreciate. I saw Judwin is back. Hi, Judwin.
Hi, I'm sorry, I'm in a metro in France.
Oh, okay. No problem at all. So it's just good to have you join us. And Elvis, just so you know, Judwin has just been commenting about the great work you're doing, and she's texting me and she's saying that if we need to go fight war somewhere, we put you in front, then we hide behind. A lot of times people who are just purely on the research side or purely on the clinical side, we just make a lot of noise on the back, but we don't have the courage. But for among us, those of us like you who've mastered the art of combining both the clinical side of your work with the public health side and the policy aspects are the people that should be leading the way in public health. We just make all this noise and write papers and critique people, but we don't have the courage that you have. So Judith was like, Alison, if we are going to look for war, we should put Elvis in front and then hide behind. We know we're going to win that war.
That's so kind.
Okay, so we do have a few people that I'm picking up that have joined us today, some for the first time and others we haven't seen in a while. And I'm just going to check on how they feel about this session. Hi, Heidi. Do you want to unmute yourself to say hello to everyone?
That's right. Sorry, I forgot to unmute myself. Hi, everyone. Very nice to be here. I think I picked a very good day. I am just so impressed by what I'm hearing, and I have so many questions for him. Maybe I'll link up with him later. But one of the things that I was just thinking when he was talking is, who are your partners in Cameroon and out of Cameroon, if you don't mind me asking?
Yeah, thank you very much for that question. Just like I mentioned, partnership has been in the journey of Unite for Health with people who are passionate about the work and not with institutions. Because at some point in time, I remember I did this work for 10 years without ever having a grant from anybody, without knowing what donor meant. I didn't know anything about donor, but my first donation came from an organization called World Connect, which is based in the US here. And they donated, I think it was $3,500 to Unite for Health Foundation at that time. That was the first money Unite for Health had ever received in 10 years. So in terms of partners, we have benefited from those who are goodwill people who would say, we love this work and they support it, not in terms of organization. We are at a stage now where we are trying to create organizational partnerships to see other organizations that can be interested in our work. But I can say proudly that the partners have been people like Tucker Robbins, people like Kenji, people who share their time and resources to make sure that this work actually succeeds. Back home, our partners are those nurses who choose to work with Unite for Health Foundation for a salary of $50,000, $80,000, instead of working for a government for a salary of $160,000. Our partners are those lab technicians who stay there in the lab to do the work for us for a meager salary than what they'll be paid in a commercial lab. Our partners are those midwives that spend time to provide good services and quality services to those pregnant women. And our partners are families and friends, people who really think that this work is important. And I think that going forward, we really hope that our work will attract institutional partnership. And that is what we are trying to do now. There is a project we want to do in Uku, which is called the Energy Health Project. And we are partnering with IBO, Internet Bar Organization, and Bronco Power, Bronco Energy. And we want to do this work in Uku to light some homes and families, but of course provide blood pressure machines and other things. So it's a work, it's still in the pipeline, but that is going to be the kind of first institutional partnership we are having with an organization. So I don't know if I answer your question, but I think that's just how the story has been with Unite for Health.
So Unite for Health is Unite for Health Africa. Are you looking to take this to other countries in Africa? Because yes. I know right now it looks like you're in Cameroon. And, yes. And that's like wonderful.
Yes.
So
yes, that we had to think Africa, because at the time we're thinking with the work started in Cameroon, and that's what I always share with people. So sometimes when you start something, you don't have a full idea of what you want. A lot of things come up and they get nurtured as you progress. When I started, of course, the idea was not Africa. But as we build and model the vision and the idea, we see that, okay, if this model of a microclinic works in Cameroon, then it can be replicated any part of Africa. Okay. And so if we successfully come out with a mobile app that can help to solve the problem of blood donation in Cameroon, if it works, then it can work in Gabon, then it can work in another place. So all it's just about building partnership and seeing how, what works here can work in another place. That's why we have to think Africa. And they always say there's nothing wrong in dreaming. We just have to dream big, even if we keep it simple.
Right.
Yeah.
Okay. Thank you so much. If it's okay, let's link up after the meeting, because I have something I'd like to discuss with you. If that's okay.
Oh, thank you, Heidi. Thanks a lot.
All right. You're welcome.
Okay, thanks for your comments and for your answers, Heidi and Elvis. I noticed we have Dr. Osric Nafti here on the platform. Hi, Dr. Nafti. How are you today?
I'm good, thank you. I just logged in a few moments ago. I think Jodwin put something up on the CamDoc group, so I sort of just logged in to see what you guys were talking about.
Don't we love CamDoc? We love CamDoc. And Doc, Elvis was saying that with Unite for Health, they've had a maternal mortality of practically zero. They haven't lost any mothers at their clinic. And I know you've got a background in obstetrics and gynecology. How do you feel when you hear this kind of data, and what thoughts do you have in mind that run through your mind when you hear this?
Sorry, obviously I wasn't party to the discussions earlier on, but that's amazing. Interestingly, I was on my alma mater class group this week, and we were having discussions about Nigeria. I studied in Lagos, so we were having discussions about maternal mortality. Now, Nigeria is a big country, but even in that big country, there's pockets of amazing practice. And really, what you're saying there just shows what can be achieved and what can be done with a bit of focus and desire and drive. It's not easy with the resources that are available locally. And so sometimes, one being outside the country looks at things in a completely different way from the realities on the ground. But it just shows that with very simple steps and with partnerships and education in terms of staff, then you can achieve amazing results. So I have a classmate who worked in a maternity hospital in Ondo State in Nigeria, and they did amazing work, reducing their maternal mortality massively just by having resources from their local state government and also using IT in terms of mobile phones and connecting in terms of ambulances, training, traditional birth attendants. So there is things that you can do. And, that's heartwarming because Elvis, if you can do that in Cameroon, in an environment where people just assume, you know, having a baby means sometimes putting yourself at high risk of death, then it's really good to hear that. That's wonderful. So I think that's commendable, and it would be useful to hear more about that, to be honest.
Thank you, Dr. Nafti. Elvis, what do you think your foundation is getting right that maybe the Ministry of Health in Cameroon, or maybe even not at the level of the ministry, maybe at the level of the district or at the level of the region or at the level of, you know, what is it you're getting right when it comes to maternal and child mortality in preventing it that others could learn from your organization?
I think to me, it's understanding the barriers to healthcare. I mean, if you think through the different barriers to healthcare, then you will understand exactly where the problem is. There was a time at our clinic where we kept about 150 identity cards. And these are identity cards of patients who have come with emergency and they have been consulted and treated. You see a child is brought with a temperature of 39 and the mother has no money. You have to treat them, and then you are done and they cannot pay, and say, okay, we're going to keep your ID card, and when you go bring the money, you get your ID. We ended up with 150 ID cards and nobody has come to collect them. And we realized how much this means to these families. To do an ID card is 3,500. You have treated the patient for 15,000 francs, and the patient will prefer to go do another ID card if they cannot pay that money. So the barriers to healthcare are enormous. Sometimes it's not just even financial barriers. Sometimes it's even just some power dynamics in the healthcare system that prevents accessibility to healthcare. So one of the things we realize is that if you provide a safe space where women can express themselves freely and you understand exactly what they are going through, you can actually really save a lot. When that woman is there in labor, she comes through the journey of pregnancy, and she's gathered a lot through that during that journey. A lot of stress from family, a lot of stress from raising kids, from being the breadwinner of the family, a lot of things. She enters into that journey with a lot. So coming to that clinic and then imagining that she still has another problem of not being able to pay her fees, it's enormous. So that's why when we thought about providing, I mean, just think about it. My wife gave birth in January in the United States, and my bill was $27,000 US for delivery, for a normal vaginal delivery. And then to deliver a woman in Cameroon is $100. Then imagine why a woman will not have money to pay for her delivery. And so you think about that financial barrier to access to healthcare, and then it tells you why a woman will not follow up all her 4 antenatal visits. What happened during that visit? How much is she being charged? You know, so a lot of private clinics are existing in Cameroon because they are trying to fill a gap that, you know, the government, and because of that, they tend to charge fees that are not reasonable. They tend to charge fees that are exorbitant. And patients don't have the choice but to go there because they don't have access to the government facility, or because the government facility is either overcrowded and maybe quality of care has become a problem. And then those private operators now come in to fill this gap and they charge a lot of fees. And so the financial barrier sets in. So I think about understanding the barriers to healthcare will really enhance, you know, maternal and reduce maternal and child mortality in Cameroon. There are a lot of other issues, but I think just understanding some of those barriers to access to healthcare, which is what Unite for Health Foundation is all about, just providing access to healthcare. And when we think about access, at the beginning, it was constructing microclinics in underserved communities so people don't walk for long distances to access healthcare. But even within the communities where we have the clinics, we now start understanding that there are other barriers, not just, you know, distance to healthcare, but other, you know, both financial, power dynamics, and other things that prevent women to have access to healthcare.
Thank you, Elvis. Gladys, Larissa, I think your hand was up. Maybe please can participants just, you know, confirm their names and then also give us an idea of where they are calling from or joining us from, and then ask their question in a way that's succinct. Gladys, Larissa, are you still there with us? Okay, I'm not sure, maybe they are trying to unmute themselves. In the meantime, while Gladys joins us, I'm just going to go around with the moderators in case they have any burning questions for you. Teresa?
Hi, everybody. Hi, Elvis. This was a good presentation, and I applaud your work, what you do in Cameroon. I remember like discussing with you, and like I've been thinking of doing something to help, and it's like, this is what I do. I'm like, oh my God, you don't even know what you're doing. It's really good. And yes, you always have the barrier. The money is always going to be an issue. You have people that they keep them in the hospital after giving birth to start working there to pay for the hospital bills. So it's not easy. It's not easy in Cameroon, and it's not easy to do what you're doing. So I applaud you, and I'm always there. I'll be there to support you. If you need anything or any help, not anything, I don't have money. I don't have money. But if you need like help with anything, ideas, I'm there to support you and all that. So
I'll be coming to you for some analytics.
yes, I'll give you that. And also, I'm willing to volunteer too. So
yeah,
if I go to Cameroon and everything, I can contact you. I'm willing to volunteer. I don't mind giving 1 week of my time over there helping you out.
Thank you.
Well, this is the beauty of the Cameroon Town Hall for Healthcare Professionals. Now we have people volunteering. And please, for those watching us both on the Zoom platform and on our social media platforms, as you've seen, you can actually volunteer your time. Whether you're in Cameroon or abroad, you can volunteer your time. You can provide, financial or health resources, whatever you're able to do to support this great initiative. And our chairman's hand is up. Looks like he has some comments for you, Elvis. Dr. Former, please.
Hi. Oh, Alison, thank you very much. And I would like to applaud Elvis. I've known Elvis for over 20 years. And each time I'm still always amazed. I tell him all the time that what he does and the way he does that is because of his experiences in life, where he's coming from. Few people do have what Elvis has. So few people have had that kind of experience to better understand how change works and how to get people to become change makers. So throughout, even as a young medical student and knowing Elvis, I've always looked up to him as a change maker and someone who is not afraid to dare. Someone who is not afraid to challenge the status quo back home in Cameroon. And I actually did use Elvis facility at a certain point where there was actually a barrier to healthcare. I don't know if you know that, but I did operate one of my cousins in Elvis Center in Bamenda with Dr. Okwen, who came out from school and was sick, and we could not have access to any surgical theater back in the Northwest, and it was like an emergency. So I had to do surgery back there. And it was quite amazing seeing how you could transform an area to being an area where someone could get to the point where you can actually transform an area to a sterile surgical unit with a little Elvis had at the time. And he was really there for quality. Now, I want to go back to the barriers of maternal mortality that we spoke about. I also was I was a director of a district hospital. Let me put it this way, back home. And Elvis, we know that willpower is one thing. There are certain barriers in healthcare, especially in labor or in delivery, that they're not really based on the health center itself. There's an issue of the woman who is coming for antenatal clinic and has to make decisions if she's going to attend an antenatal clinic or not. And public health-wise, we can intervene in that area. We can actually intervene by trying to provide education and provide a safe environment and tell them where they could go to. There is also an issue in women actually access to healthcare, meaning financial, being it the roads, the woman being in, let's say in Jikwa, and there is no healthcare center there and has to travel over to whom. I'm just giving examples, like things that really have to go on. And being in an area where there is no one who can do any form of surgery, being it a nurse who has been trained or a physician. And there is the third delay, which is the worst part of delay in Cameroon, is the one that makes people strike. Then you come to the hospital, she's pregnant, but you get people asking for things in order for them to start the work. I'm just trying to reflect the culture where the woman is in the hospital, but they want the family to pay 20,000 first. They want the family to go buy gauze. They want the family to go buy normal saline. They want the family to go buy this. So it's like before receiving care, you are already in the healthcare facility, but everyone does not want to do their job. I'm just trying to present these problems and let's see. Then there is a third delay where the case is really above the competence of those who are working there. You have a child who comes in, either the nurse is not well trained, the doctor is not well trained, the midwives, they are not able to identify maybe that there's a breech delivery or identify these risk factors. And the patients are delayed in a facility that cannot adequately help this mother and baby. So I know you've done a lot in education, and I know one of the competence of what you're doing is really trying to educate those who work with you. And I think that's where you've done a lot also in avoiding this unnecessary deaths that do occur in several healthcare centers, where they want to do what they are unable to do, or they are not trained to do. I can recall several times I myself driving women to the regional hospital because they come late to Mancon when I was there at a certain time. They come late and the child is in breech, and I'm trying to do, because I had to introduce a pathogram in the whole Northwest with one of my friends, Dr. Mbaku. We had a project on introducing a pathogram. That was like a project we wrote, introducing a pathogram. And I think I showed you that when you were in the Northwest, using a pathogram in order to reduce maternal mortality, like making it mandatory. And through the pathogram, multiple times, my nurses could identify that it was fetal distress at the time. And we had to transport these people, but at times there were no cars in some areas. So this is a very complex thing. And you were humble enough to say there could also be an aspect of luck that these women never came in and died, but you're doing something right. And I just want you to reflect on all these delays I've talked about and tell me exactly what you think about them, not necessarily the way forward. And I know you're a man of big ideas. So, and a person, I used to ask Elvis how he became the president, the youth president of a political party in Cameroon, and was so dynamic and wanted change. And I think we still miss you, though I think at a certain point you need to take care of your family, then get into so much of this. So Elvis, over to you, please.
Thank you so much, Mono, for your kind words. And I agree with you, like we have to continuously provide training to the staff, but also expose them to innovations in their area of practice. I remember in 2010, I was the first guy to bring in fetal duplas in Cameroon, and I actually gave the first to Professor Leke in Central Hospital, and he was so happy to have one from me. And then I brought just 3 of those fetal duplas from China, and I decided to give the other 2 to the clinics and 1 to Professor Leke. So Unite for Health Clinic started using fetal duplas as early as 2010. And so that has just improved a lot. Just imagine our nurses knowing that they don't have to stress to put the fetoscope on their ear and press against the pregnant woman's stomach, but then they just put a Doppler there and they can actually hear the loud sound of the fetal heartbeat. That alone already helps you to actually easily early detect fetal distress, as you mentioned. So just being able to expose our staff to innovations, basic technologies in their work is also helpful. Sometimes it might seem very expensive when you don't go deep to know how it is done. But in my in my experience, I think that is the will that is more important, not even the cost, because when the will is there, you can get some basic things to improve on work. On those delays you have mentioned, you are very correct. Those delays are at all those levels are very true. And to think about the healthcare system, you have to think about it in an integrated manner. When the Minister of Health is drawing his budget, and he does not consult the Minister of Transport, and he does not consult the Minister of Water and Energy, and he does not consult other ministries, so that when they think about a health district, they should think about all that needs to make that health district to function properly. If the road leading to Mua is not good, then you can be sure that access to healthcare is not there. But then you can't blame the Ministry of Public Health because he's not the one in charge of road construction. It is the Minister of Public Works that is in charge of road construction. Now, if Mua Hospital does not have electricity and water, it is the Minister of Public Health has a role to play, but then there is another ministry that caters for water and energy. So it becomes a time when you want to think about a particular project, you have to think of it in a very integrated manner, bringing all the different stakeholders so that one's work should not be impacted by the failure of another person's own work, which is the case we have when you have a woman who is brought late to the hospital because there was no the roads were bad, the road network was not there, or because there was no ambulance, or so many other things put together. So I think that the factors of those delays can actually be reduced if there is an integrated approach to the way we think healthcare, without just when we talk about healthcare, because the blame will be that of the Minister of Public Health when the woman will come to the hospital and die. The blame will be that of the healthcare system. No one will think about the transport system. Nobody will think about the other actors that have to play their role to ensure that the woman arrives in the hospital in a timely manner. So I think that you are very correct. We can do a lot to actually reduce some of those delays if we think in an integrated approach when we are looking at how to provide quality and accessible healthcare.
Thank you, Elvis. Gladys Larissa.
Oh yeah, I'm here.
Okay,
please
take it over. Yes, we can hear you. Okay.
Oh, my apology. I think you called on me earlier and I got interrupted by a call. So my apology to everyone. I'm gonna try to connect the video. So hi everyone. Thank you so much for this platform. I've actually been receiving invitation to the Zoom call, and I think I started joining about 2 months ago, and it's very impressive. Congratulations to all the platform and the work that you guys do. I love it, all the information. I've actually personally learned a lot from you guys, all the topics that I've listened to. I think 2 so far, I really love it. Elvis, congratulations. I'm so proud of you. I'm also a nurse. I'm a nurse. I'm a nurse practitioner too. And I'm also the president of the Cameroonian nurses in Maryland. So I'm very excited because in Maryland, the Cameroonian nurses, we work on different projects here in the US and also in Cameroon. And we've been doing that since 2005. And we've been partnering with people like you. And lately it's been hard since the pandemic to have a contact that we can sustain. So I'm actually very excited that I joined the call today. So when I heard your story and everything, I said, oh my goodness, we were just talking about maternal health. We were just talking about that in our last meeting. So I'm so excited to hear about what you've done. I'm kind of like sad that I didn't know about you because I think when I hear about your story and your background, I'm like, how come I didn't know about him? I do my best to know about like a story of nurses, anybody in healthcare, not just nurses. But I'm very excited. That's why I asked for your contact because, like I said, the Cameroonian nurses here, we actually working on the maternal project actually right now. And I definitely want to call you as soon as I can so we can talk about what we're doing, collaborate, and it's exciting. I'm just excited. And thank you so much for what you've done. And thanks to everyone who's organized this, the platform, everything that you teach is very exciting. And Thank you. Thanks for the opportunity. Just excited.
Thank you so much, Gladys, and I want to appreciate you for your leadership too in your organizing nurses in Maryland. That's very great to know about your association, and I'm always very available when it comes to just networking and helping to share my ideas and contributions to see how I can make your work successful. Feel free to reach out anytime. I'm available, and I'll be glad to speak with you.
Oh yeah, I can definitely tell you I have quite a bit of registered nurses and nurse practitioners that are ready to partner with you.
Okay.
Definitely. Thank you.
And we are open. Thanks so much.
Hey, and this is the beauty of the Cameroon Town Hall for Healthcare Professionals. We get people to know each other, to know what each other's scope of work is, and to look for areas of collaboration. As we're getting ready to round up today's session, maybe just one last question that I've had in mind, Elvis, for you. How have you successfully worked with the public health sector, with the public sector of healthcare in Cameroon? Was it an open arm welcome, son of the soil, and kudos to you for the great work you're doing and we're willing to partner? Or did you receive several kicks that you've been fighting? How has it been for you?
Yes, that's a very good question, Alison. When I answer this, Muno will start smiling because he will say it's because I'm a politician. Far from that, but my approach has been this. Knowing what is required is important for each thing you're doing. When you are in a sector, you want to know what is required for you to do your work successfully. First of all, just knowing what it takes to create a clinic in Cameroon is important, and I'll share that with you. To create a clinic in Cameroon, it's a whole lot of steps. The first thing is you have to apply for what they call l'autorisation de création. This is just an authorization that permits you to construct a facility that the ministry deems is necessary for that to operate as a healthcare facility. Then it can take you a whole lot of time to ever get that authorization. Then when it comes out, you have to apply now for l'autorisation d'opération now to start, or you're operating now as a clinic. Now to go through all that accreditation process to get your license to open a clinic, it's a whole lot of process. So you need to know what is required and you need to know what to do. But now, when you are operating a clinic, you are within a certain district, health district. So the first place to identify what is the district health service that is covering your area. You have to go know the doctor and make sure that they understand that you're providing this service. So the first thing they need from you is to help them to achieve their public health goals. One of them, which is the expanded program of immunization. So if there is a campaign for expanded program of immunization, then the Least Unite for Health Foundation as one of the clinics that will partner to achieve that. And then you send out your nurses, they volunteer, they help the district to implement the expanded program on immunization. Then the district already lists you like a partner. And so then you have that working relationship with the district, which also places you in a better position when they are talking about facilities that are officially operating within that health district. But if you look at them like people who are just trying to stop you from doing your work, because they will come for checks, they'll come for control, but if you perceive them but as adversaries, you might have a very bad working relationship with them. So in terms of our work in relationship with the Ministry of Public Health, it's been very good because we participate in all the government health campaigns and programs. And we also generate and provide all the weekly epidemiology statistics and the monthly data that we give to the district. We always send our staff to go submit them at the district. I think we've had certifications for the most efficient clinics that submit their reports on time. And so that's the kind of collaboration you want to build with the ministry to make sure that your work is in line with what they want to do. So I have not experienced any pushback, I would say, because of the fact that we want to operate a clinic. But all I know is that there was a time we applied for Lettre de Collaboration Min Santé, which is just that permits you that if we want to open micro clinics in different parts of Cameroon, so we want to have that official collaboration with the ministry, which we had it signed. And I think that's encouraging. So I think that I would say positive, that it's not been, I would say positively, it's been a very good experience for me and the ministry.
Oh, thank you, Elvis. Thank you so much for enlightening us today. So as we are getting ready to round up, maybe for those who joined us late, it's just going to be a quick recap of what this session has looked like. We began this session by having the chairman of the Town Hall, Dr. Foma Kene, highlight some of our past speakers of the Town Hall and members of the Town Hall and the amazing work that they are doing in their respective fields, either home or abroad, to promote the health of our people. And I think at this point, I'm just going to take the opportunity to remember some of them who have not been opportunity to join us at the Town Hall, especially some of them who have gone before us, both within the healthcare space and people who are not even necessarily healthcare professionals, but whose work has had a huge impact in ameliorating public health as a whole. And when I'm thinking of some people, especially those who've gone ahead of us, I'm thinking of the likes of Madam Harriet Thatcher, who used to be a philanthropist and who in herself might not necessarily, be healthcare focused, but she, thanks to her philanthropy work, drove in a lot of resources towards healthcare improvement, targeting maybe children who are orphans and mothers being inflicted by or mothers who are survivors of abuse. And, this kind of helps to ameliorate healthcare back home. I'm also going to use this opportunity to remember some of our big professors who trained many of us sitting here on the platform, either by teaching us directly in class or by holding managerial positions, which directly or indirectly affected us. And just quick, off the top of my mind, I think about Professor Peter Martins Ndumbe. Those are some of the pillars, our founding, our fathers who unfortunately are not here with us anymore, but whose service to our home, either through teaching or through grants that they've brought in, have impacted healthcare. There are a lot of other people that we could, acknowledge today, but unfortunately, because of time, we don't get the chance to. However, the key message that we're sending out from the Town Hall today is a message of thank you. Thank you to all those who are sacrificing time, finances, donating, volunteering, their physical effort to ameliorate healthcare back home. And for those of us who are still wondering, what can I do? From the recap that our chairman made, you can see by now that your work could touch on any of the sectors. It can either be you volunteering directly or training, capacity building, whatever you can do, it's never too small. As we've said before, do not complain about the darkness, be the one to put on the light, even if it's just a candle. After the recap, we went on to zoom in on our Igwe himself, Mr. Elvis Dancy, whom we've seen sitting here at the Town Hall over the past years, and he just comes, sits in here, co-moderates the sessions, and we've never really had a chance to know who Elvis truly is. And we're just thinking, what is it about this gentleman? He's always just looking so presidential, so diplomatic, but we don't get to know much about him. And today we just were able to shine the light on a little bit of the work he's doing. There's a lot more to Elvis's work that we couldn't even cover here at the Town Hall, but just shine the light on the work he's doing back home to improve maternal and child health through Unite for Health Foundation. And for those of us who haven't had the chance to either subscribe on the Unite for Health Foundation's YouTube channel or to visit their website, you can check the chat. And Unite for Health Foundation is an organization which Elvis says initially it was his organization. They've been around for almost 15 years, and they are doing great work around building micro clinics and providing services in these micro clinics, as well as telemedicine, prototype microclinic work, research and innovation, as well as professional development. The scope of work of Unite for Health is just amazing. And please do check it out. Reach out to Elvis for maybe collaborations, partnerships, and support of any kind that you might want to provide to Elvis and the Unite for Health group. That said, I'm going to hand it over to our chairman to give the vote of thanks.
So I just want to thank everyone. I think a lot of you may have logged in late. Today was a big thank you day. I see a lot of faces here, and I did say thank you to all of you. I said thank you to the moderators. for the sacrifice you've made for the past 2.5 years coming here every day. You guys have other amazing things you guys do, and I try to showcase that today. And just to let people know that this is just a side gig you guys are doing, and you guys are doing an amazing job even doing that. And also wanted to thank all our speakers who have been to the town hall and the amazing work you guys are doing. It's very encouraging to see that individuals can decide one day to just change a nation. Those who are in the diaspora and those who are back home in Cameroon, please keep doing what you're doing. And I think we're going to move that nation forward one step at a time. And we're going to move it as a group. We could also move it as an individual. Some of you are really change makers and you can inspire the next generation as others before had inspired us. So I want to also just let anyone who is here today and Haider, those I have not seen, know that when you talk about the town hall, it belongs to every health professional. The Cameroon Town Hall is an organization where we're providing a platform to better understand healthcare problems in Cameroon and to also discuss solutions. There are others who have asked me, why do we keep our time talking and not acting? I've said, there are already others doing a lot of action back in Cameroon, and we can always collaborate. There should be a platform where we can talk about these ideas, but there are also platforms where we can also collaborate. And here I'm encouraging collaboration with people who are already doing things. And if you have a topic or a problem or a solution to a problem in Cameroon and you're looking for the audience to actually talk, or you know someone who is doing something great back home or in the diaspora, who is of Cameroon origin, or who is a sympathizer of Cameroon, bring them over to the platform. We're going to provide them a platform where they can actually share these ideas. Some of them may actually get partnership from us and from members in the town hall, and we can move the discussion forward. We can move healthcare forward. We can also move social discussions into many topics that are actually, that we don't talk about. So I think in the next coming future, I will just give a highlight. We'll be talking a lot about child abuse. Maybe in the future, we'll talk about elderly abuse. So the next session, I don't really want anyone who is here to miss it because it's going to be a topic which is a taboo in Cameroon. We don't talk about it. There is a lot of child abuse back home in hospitals, and no one is really trained to identify them and take these children to safe spaces. And one of our members, presenters, brought this up, and I said this was a wonderful idea, and let's talk about it, Dr. Judwing. I don't want to let the cat out of the bag right now, but I think it's something I told you guys during the presentation how amazing this position is in different things, but in social, in actually getting to solve problems. So please, guys, I would want you all to log in the next 2 weeks and let's talk about this. And Elvis, you know what I always say, you are the reason we are here. That's the truth about it. I know you don't want to say you're the reason we're here. I used to throw all ideas I have, I throw them at Elvis. Not today. Elvis is a longtime friend. And when I was dealing with COVID cases, we're both in New York. I'll call Elvis, talk to Elvis about the number of cases I'm seeing. Elvis is like, he's so worried about what is going to happen to Cameroon. I'm like, Elvis, can we just do something? You're good at moderating things. Can we do something and educate the nurses, the doctors back home before COVID ever breaks out? And Elvis actually encouraged me for us to get to start this. And I just want to thank Elvis always for being, how do I put it? Someone who has the quality of savoir-faire and savoir-être, knowing how to relate with people and also being able to achieve the knowledge that people respect you. So today was a day we wanted to actually showcase what you're doing. And I think others got to know you, but they don't know all of you. They don't know even half of you. So the political part of you, they don't know it yet. So the part I used to say, I saw you over CRTV and I text Elvis and I see him looking at the text. I'm like, I'm watching. So, and we're still very young. So Alison, thank you very much. I can talk about Elvis for a whole session because it's, it makes me very emotional, really understanding that we do have people that are willing to put their life at stake in order for Cameroon to move forward. And Elvis, thank you very much. I know you've been part of what they call in Cameroon, the opposition moving Cameroon forward, not opposing, but proposing ideas in order to get Cameroon really move ahead. So thank you very much. And please, a reminder, the platform belongs to everyone. If you are having an idea, just shoot it over to Elvis, to Alison, to me, to Brian, to Christelle, to everyone whom you can, all the moderators, and we'll get you on the platform at any time. So thank you very much.
Thanks.
Thank you, Dr. Funa. Elvis, any last comments from you?
Oh, sorry. I was sharing the jingle already. The chair has already spoken. In our culture in Cameroon, when the chair makes the final statement, nobody speaks. So if I'm speaking, I'm going against tradition, unless you want me to, but then I'll only say, thank you so much. Merci beaucoup.
Thank you, Elvis. And please, there's the official town hall ends right now, but after this, we have the parking lot. And I hear there's going to be a show today at the parking lot. So please hang around, get to chat, to know people a little more, and to network in the parking lot, which follows immediately after this session of the town hall. And for our next town hall, as Dr. Muno has said, we have some exciting stuff for everybody. So please keep your eyes glued to your emails around that. And everyone, see